discuss blood transfusions. Hello, this video is to discuss blood transfusions. To begin with, we always need a physician's order prior to beginning any blood transfusion. Anytime a physician orders a blood transfusion, you always want to ensure that a type and cross has been ordered so that you can get the correct blood up to your patient. Secondly, prior to starting a transfusion, we always want to get a baseline set of vital signs, and we want to listen to the patient's lungs and assess for any reactions in the past. And we always need to get a patient's consent prior to beginning any type of transfusion. And you always want to check your patient's IV and ensure that that is working well, that there are no issues. It is preferred to have an 18 or 20 gauge IV for blood transfusions. In the event that a 22 gauge is all that you can get, that is acceptable, but you will have to transfuse at a slower rate with that size IV. Monitor the IV site during the transfusion to ensure that it has not infiltrated or caused any issues with the skin during the entire procedure. After you have done all the initial requirements for a blood transfusion, you want to ensure that the patient doesn't need any pre-medications before starting. Sometimes patients require pre-medication such as Tylenol or Benadryl to prevent any type of reactions. We always want to assess the patient's temperature and continue monitoring that so that we can ensure they are not having a reaction to the blood once that begins. Once you have your order and everything else is in place, you want to send down your baseline vitals and all of your information to lab so that they can get the blood prepared for you. To go get the blood, you'll take your patient's information sheet and the consent has to be in your chart, and you pick that up from the lab, and then you will be prepared to begin that transfusion. Prior to picking this up, we typically want to go ahead and get our IV tubing prepared so that when it is here, we can get that started. After you have picked up your blood from the lab, you have a total of 30 minutes to get that started. If you do not get that infusion started within that 30 minutes, you need to return that to the lab so that they can properly store that until it is ready to be used. So we're going to go ahead and prime our blood tube. Prior to beginning any further, we will of course perform thorough hand hygiene and apply clean gloves. And we're going to open our blood tubing, and I'll show you just a little bit about this. This is called your Y-tube blood solution set, and we'll get that open. And you'll see that you have two areas for one for your normal saline and one for your blood product. We always use normal saline when giving blood transfusions, and we typically use either a 100 or 250 milliliter bag. We'll want to go ahead and close all of our clamps on our tubing, and then we can go ahead and prime our solution with our normal saline. So we'll take our normal saline, and we're going to use one to spike that. And everything is still clamped, so we'll hang this, and then I'm going to allow that to fill my line. So I'm just going to open the one that's connected to my normal saline, and I'm going to go ahead and pre-prime this tubing to the end, and now I'm ready to get my blood. So I'll remove these gloves again and wash my hands, and then we'll go get our blood product from the blood bank. Once you've returned from blood bank, of course, we'll wash our hands again and we'll apply new clean gloves. And we will verify that we have the correct product and verify that with our patient's armband with another nurse at the bedside. You or the other nurse will read information from the patient's blood band, and one of you will check against the bag and the slip that was sent up with your bag of blood. These should all have matching armband numbers with the patient's blood band. It should also have the matching and correct type of blood, which we are O positive, and here on our paper is also O positive. Then on your patient's blood band, it should also say O positive. We have the unit number, which here we have 212-1515. On our paper, it is 212-1515. And then the other nurse will also verify that on the blood band, it is 212-1515. We'll verify the date of birth, the patient's medical record number, their name, and ensure that we have the correct blood product and that it is not expired. So again, on this one, expiration date is 02/07/2023, and the other nurse will verify on the bag that the expiration date is 02/07/2023. And then once everything is verified, you have that documented in the computer, you can begin your blood transfusion. I'm going to go ahead and spike with the other port on my blood transfusion set. So you'll take the other end, which is locked off, and ensure that your normal saline is locked off as well. And we're going to open our blood and insert. And then I'm going to hang that up, and then I'm going to go ahead and prime this bag with our blood product. And to prime that, I'm going to open up our tubing to our blood, and that will start to flow. And then I'm going to open up my tubing to the end of my set, and I'm going to let my blood flow into the chamber. This chamber has the filter, which helps filter out any impurities or issues in the blood. Product itself, which of course when we get this bag to the floor, we want to check it and ensure that it is good prior to using. You want to ensure there's no sediment, no clumps, anything like that. And we'll do that while we're checking the bag with our patient's blood band. So we're going to let this go down to the end of our tubing. And you can do that, you can just do like a pink tinged at the end. You do not want to waste any of the blood product. So ensure that you're able to lock that off and keep that inside the tubing. Now we're going to leave the saline locked, and we're going to leave our blood open. And then we will be using a blood transfusion set. That is not here at the moment, so but it is a special IV pole set that is used for blood transfusions. So we will go ahead and clean our patient's IV, and we're going to connect the blood tubing, and then we'll open up our tabs and we'll get that started at a slow rate, usually about 50 mLs per hour for the first 15 minutes. First 15 minutes of a transfusion, we want to stay at the patient's bedside, and we want to monitor them for any adverse reactions. So after the first 15 minutes, we're going to do a recheck of all the vital signs. We're going to listen to their lungs, and we're going to assess and ensure that they're not having any reactions to that. Then we want to get our blood transfusion turned up some, as long as our patient's tolerating it well. And we will ensure that this infuses within 4 hours. The sets are only good for up to 4 hours and for only one transfusion at a time. Once you've done one transfusion with this, you do not use it again. It is done, and you toss that into the biohazard. After your blood is transfused, you're going to continue to monitor your patient and continue to monitor their vital signs. When it comes to doing vitals, we have a sheet that typically comes up with our blood, and on this sheet you can see you document those, and you most likely in most facilities also document those in the computer system. After you have sent down the order, you're going to take your vital signs, and you'll have that to pick up your blood product from the lab. Once you return and prior to beginning, you're going to reassess the patient's vital signs one more time. Then we're going to do a 5-minute check, a 10-minute check, and a 15-minute check. And at that 15-minute check, once that is complete, if there are no issues and the patient's tolerating it well, we can bump up our transfusion. And then thereafter, we're going to do vital signs every hour until the transfusion is complete. And once that is complete, we will also do another set of vital signs at least another hour prior after that to ensure that there are still no issues and that the patient has tolerated the blood transfusion well. After you've completed, of course, you do all your documentation, and we can open up our normal saline and let that continue to ensure that the entire transfusion is done, and then we'll remove that from the patient's arm and we will flush their IV. After you have completed the transfusion, your patient's comfortable, you've assessed their lung sounds again, ensured that they're having good urinary output and that they have no fever or have had no reactions to the blood. You will ensure that everything has been documented, and you will take your blood product and take that to your biohazard bin and continue to monitor them for the next hour to ensure there are no reactions. If your patient does have a reaction, you need to follow the steps that are in place and in protocol for blood transfusion reactions. Number one, you always stay at the bedside with the patient. You yell for help, have those contact your physician, continue to monitor.